Tonight in Medical Rounds, deciding whether to have breast reconstruction surgery is a very personal choice. Just one of the many decisions that women face after receiving a breast cancer diagnosis. So how do you make that decision? Here with us tonight to help is Dr. Alan Babigian, a plastic and reconstructive surgeon at Hartford Hospital. Good evening, Dr. Babigian. Thanks for being with us tonight.
Hi, good evening. Thank you for having me.
First question for you is, how do you know if breast reconstruction is right for you or if you even would be a likely candidate?
Most people who undergo mastectomy are definitely candidates for some type of reconstruction, but the decision to undergo reconstruction itself and the decision of different techniques of reconstruction are a very personal one. So it's important that you meet with a qualified plastic surgeon before your planned surgery so that you can discuss the options properly.
Let's talk about timing. Are there benefits to having immediate reconstructive surgery at the same time as your cancer surgery versus having the cancer surgery and maybe just waiting?
There are some benefits to having immediate reconstruction, and the main benefit is that if you have one surgical procedure or one series of procedures, they're all done at once, so there's really only one healing time or one downtime. But it is important to note that you can also undergo your cancer care first, and that it's still very possible to have a delayed reconstruction afterwards.
That's good to know. What about new techniques, new treatment options, reconstructive options that are available to women today? What's out there?
So there are a number of new reconstructive techniques that are available to us now that weren't available in the past. And for instance, there are a number of different new implant styles or flap reconstructive techniques that can be used now that are more realistic than what we had for options in the past. There are, again, a number of options that are available to patients, so it's important for them, again, to meet with a qualified reconstructive surgeon before they do any type of surgery so that they know all the options that are available to them.
And you did mention in the beginning treatment is key. The question I have for you is, can reconstructive surgery interfere with chemotherapy or radiation?
We actually do our best to avoid that, and we know that it's very important if you require chemotherapy or radiation, that those are the most important parts of your cancer care, and our reconstructive surgery should be subjugated to that. So while chemotherapy or radiation can complicate our reconstructive efforts, we work with our other specialists to ensure that we can make sure our timing is proper and that we minimize the risks of our reconstruction in the setting of chemotherapy or radiation.
All right, great to hear. We thank you so much, Dr. Babigian, for sharing this important information with our viewers tonight. You've given women out there a lot to think about. Now, if you'd like to learn more about reconstructive breast surgery at Hartford Hospital, call Cancer Connect at the number you see on the screen.